In the examination of the respiratory system, today we will be seeing percussion and auscultation. First, the supraclavicular area and compare it with the other side. For percussion of the clavicular area, do not use the fleximeter, directly tap on the clavicule and compare it with the opposite side. Percuss the infraclavicular area and compare it with the opposite side. And percuss all the mammary and inframammary areas. Note the position of the volunteer for percussing the axillary area. Percuss the axillary area and compare it with the opposite side. Infraaxillary area also. Note the position of the volunteer for percussing the posterior side of the thorax. Suprascapular area and compare it with the opposite side. Avoid the spinal and the paraspinal areas since it is composed of muscles and bones. Percuss the interscapular areas and the infrascapular areas. For auscultation, explain the procedure to the volunteer and wear the stethoscope in the appropriate way and make sure the knob is turned towards the diaphragm. Auscultate the supraclavicular, infraclavicular mammary areas. Instruct the subject to inhale through the nose and exhale through the mouth. You can even ask the subject to turn away from you to avoid infection. The position of the volunteer is the same as for percussion. For vocal resonance, explain properly to the subject. When you place the stethoscope on the chest wall, ask him to say 99 and do not say 99 when you are not placing the stethoscope on the chest wall. Perform vocal resonance on all the 9 areas of the lung. Make sure you always compare the vocal resonance with the opposite side.